So luckily we're not alone here because
Yes.
we're flying blind here, Shafiro. Good thing we have from MMC Hospital, Dr. Ria Lestari back in the studio with us. Thanks for joining us again. Great to see you.
Thank you so much.
Okay, first of all, let's talk about this injury. We often hear, especially when it comes to sports, I watch a lot of sports, especially basketball. And in basketball, a common injury is you hear ACL or MCL. Can you explain first the differences between the two and what is specifically an ACL injury?
Okay, ACL is one of the ligament in our knee that the function is for knee stability.
Okay.
So for example, like ACL is helping you to stabilize the knee and without like moving your shin, like going
Left
forward.
or right? Okay. Right.
Yeah, but MCL located in the middle of your knee.
Okay.
Yeah, and then there are also LCL located in the lateral of the knee.
All right.
And there's also PCL. It's located in the posterior of the,
back.
knee.
Oh.
Yes,
All
the back.
around.
Yeah.
Okay, so why is it that the ACL is the one that most commonly hear is the one that injures?
Yeah.
Is it the main one? Is it the most important one?
Now, actually, the main concern is the hamstring because we tend to neglect the strength of the hamstring itself. Yeah, sometimes we tend to like just focus in the front.
Correct.
So we forget the back of our thigh. We also need to strengthening that one. So that's why in the sports medicine, hamstring and quadricep ratio is very important.
Okay.
So you have like the balance of the strength between like the front of the thigh and the back of the thigh is the same.
It should be 50-50.
Supposed to.
Really? Because most people, we want to work on what we can see in the mirror. So when
Yeah.
we do
Yeah,
leg
like-
exercises,
Yeah,
we're like,
yeah,
ooh, I
yeah,
like the
yeah.
way my quad looks. Nobody ever looks at the back of
Yeah,
the leg.
yeah,
We
yeah,
can't
that's
see.
correct. Yeah.
Right, okay, I see.
So we really have to be very careful about that and really have to pay attention about
Correct.
our training as well.
Yes.
So how dangerous it can be, a doctor, especially when someone really, didn't take care of it in the first time, and if it's late.
Yes, because the most concern is the number one is going to be the muscle loss.
Okay.
It's going to be like a loss in size or it's like a loss in strength. So if you see if you get injured ACL, for example, like within in a days or in a weeks, you will see the difference between like your right and left side.
Okay.
What's wrong with my right knee, the injured one? Is it like a decrease in size and also decrease in strength?
Okay.
It's going to be an issue if you are an athlete.
Right.
Okay.
Yeah, you don't want to like have a different size and different strength for
Right.
an athlete, especially you are like a basketball player or like
Be
a soccer
imbalanced
player.
as well,
Yeah.
right?
Correct. And then after that, the second one, if you have a delayed treatment, it's gonna be like we have to pay the price like in the future time.
Right.
For example, like if you delay the surgery, I don't want to do the surgery.
Yeah.
The issue is gonna be osteoarthritis.
Okay.
And then also like if you delay the treatment according to journal in the American Journal of Sports Medicine, there's also like the specific time to do the treatment is around like 4 weeks.
Okay.
And then if you delay that one, it's gonna be like arthrofibrosis, which is like it's gonna be causing pain on your knee. You cannot straighten the knee, so it's
my
gonna be like another issue you have to pay.
Long-term effects.
Oh
right?
my
Yes.
God.
So how do we, an ACL doesn't just, for a lot of people, a lot of athletes I've seen, it just actually literally happens while they're in competitive sports. But are there any signs, early warning signs, and what are the causes? I know you can't prevent it fully, but what are some of the causes that can make this happen?
Okay, if we talk about the causes, we cannot say like there's only one causes.
Okay.
We have to see like from like many factors. For example, there's internal risk factor, and an external risk factor, and also inciting events.
Okay.
So for example, internal risk factor, we're talking about ourselves, like our age, and then is it female or male, and then what about your body composition? Are you overweight, are you obese, or are you skinny? And then what about your muscle strength?
Okay.
That's the internal factors. And then the external factors is about like the weather, environment,
Right.
the road, the grass, that kind
Slip
of thing.
on a piece
Yeah,
of-
the thing that we cannot control.
Right.
And also the last one is inciting events. Inciting events is the one that we talk about, like how you play it.
Okay.
And then how the other player play.
Okay.
Is it like a rough? Is it like a slow? It just depends.
So, for example, if somebody is more of we're seeing clips here, if somebody is an explosive jumper, this is Derrick Rose, somebody whose basically career completely changed when he suffered not one, but 2 ACL injuries throughout his career.
Wow.
Now, basically he used to be a very explosive jumper, and a lot of sports experts have said it's because of the style of the way he plays that it actually caused his injury, or it put him at a higher risk for injury. Is that true?
Is it true? Because the mechanism, usually ACL, 70% of ACL is due to like a non-contact mechanism.
I see.
Like for example, this one is like due to the landing itself and then the jump, the mechanism, the biomechanic of the knees, how you land and then how you twist. It's going to be the issue. 70% of ACL injury due to the non-contact mechanism.
All right. So, you know, again, something like this, you cannot see any early warning signs. In fact, I remember a couple of these injuries because a lot of these injuries were debilitating and they had to be out for a long time. And you could see one of them is from jumping, so one of them is from landing. Another one was actually just him dribbling, and then suddenly he just lost control because and also a lot of times they say they felt something pop or
correct.
Right? Now, a lot of times they would take up to a year off, so around 8 to 10 months. This is after surgery. Why does it take so long to recover from this injury?
Because the timeline we set for an athlete to go back to a return to play or playing basketball is around 6 to 9 months. Okay. But the issue is it's not just doing the rehabilitation, but we have to do the reconditioning. Yeah, because it's an issue for an athlete if we just do rehabilitation. Because rehabilitation, we talk about we're putting back we're putting back to the normal movement, normal power, normal strength, the injured side. But we don't want to neglect the uninjured side.
Right.
So that's why you have to do reconditioning.
The muscles and the strength training as well. So it takes time. So doctor, you mentioned earlier about the put things, through the surgery. Can it be back to normal?
It can actually.
Oh yeah?
Yeah, you can just in sports medicine, the term is return to sports. So there is time then when you can return to sports and play just like you before injured.
Okay.
Yeah, it is possible.
Okay, can you explain a little bit? I understand muscle injuries. For example, if somebody tears their quad, a muscle can literally kind of heal itself and will go back together. In fact, what you're doing when you're exercising, you're actually putting tiny tears in your muscle and it grows back stronger, which is why your muscles grow. How does it work when it comes to a ligament? Because that's completely opposite of what happens with the ligament. So what is this process of healing? It doesn't heal by itself. So what is the actual process of the surgery?
So because ACL tear is a ligament tear, so ligament itself doesn't have any blood vascularization like a lot of it. So that's why if you have a tear ACL, you can heal the knee. Yes, you feel no more pain. Yes, but the instability, you will feel it. Because the ACL is responsible for knee stability again. And ACL cannot heal by itself because due to poor vascularize. If you have no blood vessel, it means no nutrients. And no nutrients, it means you cannot have a tissue repair.
I see. Okay, so that actually requires a process of getting in there, having an operation, and having them actually, they rejoin the ligament back together?
If it's possible, or they take it from somewhere else, for example, most of it from hamstring.
So the substitute.
Yeah, the substitute. We have graft.
Okay. So doctor, is it only athlete can be injured by the ACL, or someone who have that kind of habit, like using the heels every day, can be
actually
injured by that?
Everyone is not
safe.
It's not safe, I can say.
Wow.
So because it just depends how strong your muscle to stabilize the knee. So that's the key. For example, perhaps you have a torn ACL. Perhaps it's just a grade 1 or 2. But since you have a strong muscle, strong quadriceps, strong hamstring to support the knee, you feel nothing.
It doesn't get further either.
Really? Correct.
Okay, so you can actually have, they're grades. You mentioned grades, so that means how severe it is.
Yes, correct.
Okay, and that's according, now you mentioned the factor of being strong. You also mentioned obesity. So if someone, I've heard that if someone is actually obese or heavier than they should be, it actually puts more pressure on your joints, which could actually cause injuries like this. Is that true?
Yes, correct. But we also have to think it's not ACL only, because on the knees, there's something else. For example, meniscus.
Yes.
Meniscus is, let's say, it's our knees pillow that layer up then provide like the bouncy thing, like
Yes,
between the
cushioning.
femur and the shin bone. So it's just like the pillow, little pillow. But
Okay.
the issue is, if it's a rib or if it's tear,
Yeah.
yes, the good news, meniscus can heal by itself, but you have to strengthen, again, you have to strengthen the muscle that has to support the knee.
Okay.
Okay.
So you keep going back to this issue of strengthening the muscles around it. We do know when it comes to injuries, one of the best things you can do, whether it's your back or whether it's your knees, is to strengthen or your core, just keep a strong core. They say that'll always prevent injuries for your lower back. Now, how can we do the same with our knee? Like, what parts of the legs do we need to strengthen, or is it overall strength?
Okay, for example, like an ACL usually, ACL is to prevent like our shin bone going forward.
Right.
That's the main function.
Okay.
So the thing we have, the need is we have to have a strong hamstring.
Okay.
The one that we always neglect it, usually.
Yeah.
Yeah, so that's what like a strengthening, like a hamstring is simple, like a deadlift, you can do that.
Okay.
Yeah.
Like curl or glute bridge, you can do a simple thing, even at home.
All right. Not all the exercises that guys don't like to do, except maybe that. So,
But we have to.
But not
We
everyone
have to
can go
keep
into
this
the
knee
gym and do
Yeah.
strongly.
deadlifts. So
Exactly.
are there any things that we could do perhaps on our own or at home in order to help strengthen?
To prevent
yeah.
to
help
get
prevent
injury,
this.
of
Yes,
course.
for example, like a hamstring, if you don't have any access to the gym, you can just do using, for example, perhaps like if you have a small dumbbells or like just like a. I'm
Could you
gonna
show us? Let's do
Yeah,
some
let's
together.
Do
show you
something
little
to
bit.
strengthen our.
Okay, for example, it's much more
Knee.
easier, like a chest open, shoulder width. Okay, the much
not-
more important is
it's
to
not
hinge.
Here.
Hinge, yeah.
Okay.
It's not.
Don't
bend-
curl your back
yeah,
like a
don't
cat.
curl your back, but hinge.
Okay. Right.
So you will feel like, oh yeah,
oh
our
yeah, it's tightening behind
It's
the leg.
tightening, yeah, that one.
Okay.
It's one of the exercises. Like for example, if you have like a small dumbbells or just like a stuff, you can like put it in the front and you just
Okay.
hinge.
Just to add some weight.
Yeah,
more
add
weight,
some weight.
right?
Yeah.
Do we keep our knees locked in this position?
Not
No.
superly locked, just a little bit bend would
Slightly
be nice.
bent.
Oh,
Okay.
You will feel right, like in the
Yes.
hamstring. Oh yeah, it's being pulled.
Very tight.
Yeah.
Because our hamstring is like located in the. There's like a two joints,
Okay.
hip and also knees. Like doing a leg curl like this, using
Yeah.
a resistant bend should be okay.
Ah, okay.
Yeah, you can feel like, oh, I'm gonna touch my hamstring, I'm gonna curl. Oh yeah.
You can feel it
So,
tensing
doctor,
up.
Yeah.
if we get the injury in our knee, so it can affect it to our this one too, ankle.
Oh yes, correct. That's why one of the
okay.
exercise that we need also to do is the balance exercise.
Okay.
Just like it's very simple. Just like one, lift your one leg, just touch in the front, touch in the side,
Right.
and touch in the back. It's a very simple thing.
Okay.
If you want to add more like a difficultiness, you just like add like a pillow or like a foam
Okay.
on the top of it. So it's gonna be
There's
make
some
you
level.
harder. Yeah.
Oh, I see. So you
Okay.
have to see. I guess with an exercise like this, I believe is it called a stability exercise?
Yeah.
Okay. So stability exercises. What it does is, what you're trying. How do you feel when you're doing that, Shafira? You feel like you're trying to stay
Of course, and
upward.
stable.
Yeah.
But
exactly.
what you don't realize is what you're doing there is actually doing the work. By
Yeah.
you trying to balance, it's actually
okay.
straightening all those muscles. Correct?
Correct.
Doc?
Yes, correct.
Okay. So how important is doing stability exercises in order to prevent these injuries?
Actually, it's very important because we don't want to neglect like any other exercise.
Okay.
Too. We have to like to do it like also together with the strength exercise. Usually, I put the balance or the stability exercise is after we do the strength training, just like a 2 exercises.
At the end.
At the end.
Because I don't see, like I see a lot of people doing this. I see a lot of people doing this. I don't see
It's
anyone
really
doing
like
this.
doing
at
the, like
gym.
the
because I
balance
thought
exercise.
I am so weak by doing this, and
Right.
I'm become very unstable.
But that's the thing. You have to do it.
okay.
Yeah.
Okay.
And usually I like to do it like after every leg exercise, so you feel wobble, right?
Right.
Yeah.
Yeah. That's the thing. That's the stability you
so
will
we have
work
to
on. Yeah.
Practice that in order to be more
Yes.
strength.
Because that's when we're
cool.
feeling our weakest, though.
That's the thing.
That's
You
why.
yeah, that's why. If
Ah.
you like do it like a stability exercise at first, you will feel like, oh, this is easy.
Right.
This is
True.
easy.
Right.
This is easy. But after you do like a leg exercise,
Okay.
and you now after that you do stability exercise, you feel like, oh my gosh,
Yeah.
this is
It's so hard.
But you will
I-
think like how to hold this tight even
Okay.
more.
So,
Now
how
I understand.
is this? Do you have any other stability exercises that could be effective for us in preventing injury?
Lunges, you can do lunges.
Lunges are
Lunges.
considered it as well.
Yes.
I see. Okay.
But not
What's
the-
the proper way to do a lunge?
Okay. If you think like a train track, yeah. So put like your legs like a train track.
Okay.
Just move the left one like a regular train track. So many people like do lunges. It's like a one line in line, like between
Right.
the front and
Right.
no, you cannot do
Supposed
that.
to be
That's not good for you.
Not?
Okay.
No, it's not supposed
So
to
you
be
have to
like
be on two
in the
separate
train
rails.
track.
okay, like this.
Yes, and just do lunges.
Now,
Round.
I've heard a lot as well about how where your knee needs to be positioned in your foot, but people say
Yes.
different things. What's the right way?
Actually, if you want to do like a knees, like a travel over the foot, it's
Yes.
gonna be hit different way. It's gonna be hit your glutes.
Yes, I can
Right.
feel that. Right.
Yeah.
Okay.
Yes.
here.
Yes, correct.
Okay.
But if you just want to do like the knee, just like before your toes,
Yes.
it will hit your quads.
Ah, yes.
Okay.
It
Right.
just depends.
Oh,
I see.
okay.
Okay. What do we
Well,
want to
we
do? What's the
bend
best thing for
into
us
forward.
with the goal we're trying to accomplish, which is
Okay.
stability?
For the stability, for example, if you cannot, oh no, doc, it's very hard for me like this, I'm so wobbly, you can just hang on to something and
Oh,
do
Oh, really?
it.
That's
okay.
allowed.
That's
Okay.
okay.
That's okay.
All right.
Everybody starts somewhere. That's all right. No worries about it.
Okay.
Okay. All right. Now I understand to do some movement at the gym.
I never knew that a lunge was a
Exactly,
stability
the
exercise.
stability
I
as
looked
well.
at
Yeah,
it.
because it challenges you like to move like properly, and then how you need to still like keep it forward.
Okay.
And there's like because we don't want to do the cave-in movement,
Which
like the knee is travel inward.
Okay.
Okay. So, doctor, if someone has the ACL, how can we prevent ourselves to not getting worse?
Okay, at first, like you have to identify. Okay, I have injury. That's the first. The second one, you have to know the mechanism. Like, is it contact or non-contact?
Okay.
Okay.
And then the third one is you have to introduce the preventive measures, such as like a strength training,
Right.
Okay.
load your training monitoring.
Yes.
Like you have to know the load.
Oh,
Okay.
Sometimes people just like, oh, I lift 5 kilos or I lift 100 kilos.
Right.
Okay.
But you don't know like the load.
Okay.
That's
So
the thing.
we don't know. A lot of times. Let's have a seat because I'm
Okay.
getting
Oh,
tired.
yes, doctor.
Oh,
like
those
to
lunges
stand.
took a little bit. Out of me.
Yeah.
So you mentioned load. I've also heard as well that you need to, like, say you want to do 50% of your load.
Yeah.
But how do we know that number? Like, what's the best way to find out this number?
Okay. Like for example, if it's possible, you can find like your 1 RM, like a 1 repetition maximum.
Okay.
If it's possible. But
Okay.
if you can't, you have the 1 RM calculator. So for example, I can do like a squat for 70 kilos and then for like 10 times.
Yes.
So you just put it in the calculator and then
And they're gonna
you'll
work it
find-
out for
Yeah.
I see.
Yeah,
Okay.
you have to check every time you want to do the regular
Internet's
exercise.
amazing these days.
Okay. What about the daily behavior, doctor? Like how we sit, like how we stand, or when someone got the ACL?
Oh, actually, if you got injured, the very first thing to do, you have to lift the leg. So the blood is not go down, so
Right.
you will not get like a swollen.
Oh,
Okay.
Yeah, so you just like lift your legs and then get it icing.
okay. Yeah.
Yeah, because icing helps to minimize the swollen.
Yeah, okay. Oh,
Well, I'm glad you were able to put the spotlight on this because, again, like I said, a lot of people that go to the gym, they do all these things, they go on the treadmill, they lift their weights.
Exactly.
But I almost never see anyone do any stability exercises, and I think this is
now we
something-
know.
Yeah, something that we do need to know to do a little bit more. I myself am very guilty of it. I don't do any of the stability exercises.
You don't give me the tips, but
Because we
now
wanna
we
do,
know, right?
You know, it's a guy thing. It's a bro thing at the
Exactly.
gym,
Okay.
right?
Now
But we
we
do
know.
need to
Thank
focus
you so
more on
much,
that.
doctor.
No worries about it, my
To
pleasure.
give us some enlightenment about how to prevent ourselves from getting injured by the ACL.
That's right. And we hope that
Lovely.
you stay safe out there. Even though you're exercising, make sure that you're doing so safely.
All right, guys, we're up for another short break. In the meantime, don't forget to follow our social media platform if you haven't done so. We're on Instagram, Twitter, and YouTube at See Today News Station. Right here, we have more updates only for you. Thank you so much, doctor.
Thank you so
you.
much. Thank